If your hip's stiff and painful, sex is probably the last thing on your mind. But what about after you've had your hip replacement surgery? Within a few months, you'll feel fitter, stronger and younger than ever. You might start thinking about more than just doing the gardening again. When I was a trainee, orthopaedic surgeons didn't talk about sex to their patients. If the subject came up, they usually said, speak to the nurses or the physio. Everyone looked a bit embarrassed and things moved swiftly on. But because I'm a specialist in hip surgery, I've treated lots of young people with hip problems. Quite a few of them have gone on to have families after their hip replacements. It was pretty obvious to me that there wasn't much information out there to advise them about sex after surgery. I set up a study with a couple of colleagues. We wanted to find out what information there was and hopefully bring it up to date. We found that there had only been 12 academic papers since 1970. We developed a questionnaire with the help of a consultant gynaecologist and set about getting approval to do the study. In the UK, you have to submit it to the local ethics committee before you can enrol patients. Some of the questions were understandably quite intimate, and our first attempt was rejected. I wrote to Dame Jenny Murray, who at the time was the presenter of Woman's Hour on BBC Radio 4, to see if she might write a letter to support our application. She'd recently had her hips replaced. She was brilliant. We got the all clear from the ethics committee. We did a pilot study of 60 women under the age of 60. They did the questionnaire before and after surgery. The results were fascinating. Nearly 90% of the women said that their hip arthritis had a significant effect on sex. 70% of them said that returning to sexual activity was part of the reason that they decided to have surgery. 6 months after their operation, over 70% of them said that they returned to normal or better sexual activity. Most of them said that they were more confident after surgery and felt emotionally closer to their partner. 80% had sex within 2 months of surgery. One patient had a dislocation during intercourse, but there were no other complications, regardless of the position. We had hoped to do a much bigger study and then do another one for men so that we could publish the information as a booklet. It never really happened, sadly. The person who was going to do the study moved on and we couldn't find anybody else suitable to take it on. Still, our pilot study gave us some fascinating and pertinent information. Having sex after hip replacement surgery is safe, and it's more than likely to be better than it was when your hip was painful. Isn't that fantastic? If you'd like to know more about hip surgery, then please get in touch. The details are below. Thanks for watching.